VA claims for arthritis. Typically, you're going to get a 10 or a 20% rating. So I wouldn't consider this a high value claim. High value claims come in at 30% or higher, but this may get you over the hump, get you into the hundo club, get some movement, and more importantly, it may be something you're dealing with and you should be getting paid for it, and you could prove it. So with arthritis, there's a few things you need to know. It depends on the number of joints that are impacted and whether there are occasional incapacitating episodes. So here's the thing you need to know about arthritis. Joint conditions, first they must be rated under limitation of range of motion. So that needs to happen first, and then they could be rated as a degenerative arthritis or arthritis. So you need to address the limitation of range of motion before you even go filing a arthritis claim. So VA's rules, right? Got to figure out how to play their game. So this is something that you should know about arthritis. Degenerative arthritis, what I have, what you probably have, can only be rated under a separate diagnostic code if it does not cause limitation of range of motion in a joint. And the whole thing with the limitation of range of motion, they'll give you like 10% for pain. They'll give you like 10% for limitation of range of motion. Kind of depends on how limited you are. So you have to check these boxes before you get to the arthritis stage. We're all going to get arthritis. This is like very common, right? Radiculopathy is pretty common. I have it. You might have it. These are all things I'm just kind of throwing out there for you to think about. At the end of the day, you need a doctor on your side, with a diagnosis, symptoms, and a nexus to make this stick. You have to prove your claim. That strategy, that's my boot camp. That's what I talk about. I preach it and I teach it. You need a doctor that can help you with a nexus letter. Check out my med team. Here's an email address. Hit them up. Tell them you need a nexus.